Hi guys, while my papa is playing outside, I am going to introduce you guys to euthanasia debate and assisted suicide part 2. Welcome to Tiny EIKX episode 71. Euthanasia is the intentional ending of a life to relieve pain and suffering, with various forms including physician-administered euthanasia, self-administered euthanasia, as well as assisted suicide. The practice is legal in some places, such as Canada. It didn't used to be, under specific conditions, for medical assistance in dying, MAID, MAID. While in others, like the UK and parts of the US, it's illegal and considered murder or assisted suicide. However, here's the thing is, the most assisted suicide doctors are down in the States for private payment. So, there you go. The term is also used in veterinary medicine, where veterinarians humanely end the pet's life to alleviate suffering. I got something to say about that. I have never put my dog down. So, anyways, the purpose is to end suffering for terminally ill or incurable ill patients like me with neurodegeneration. It's getting worse. Types: active euthanasia, which is physician-administered MAID. It means a doctor or nurse directly administers the legal substance, much like capital punishment, but assisted suicide, self-administered MAID. A doctor provides the means, such as prescription or medication or whatever, for an eligible person to end their own life. Now, voluntary versus involuntary. Euthanasia can be classified as voluntary with consent, non-voluntary when the person cannot consent, or involuntary without consent, which is considered murder. Euthanasia's pros include respect for autonomy, ending severe suffering, a good death with dignity, and reducing burdens in families and the EI system. So consider ALS, consider MS, consider fibromyalgia, consider Parkinson's. Anyways. All right, cons include religious prohibitions, which no, you know what? If you're a fucking Jehovah's Witness, which I studied with them when I was younger, just got to Canada, and they don't allow blood transfusion. I mean, excuse me, you're trying to save someone's life. There's no blood transfusion. Are you kidding me? All right, so cons obviously include religious prohibition, conflicting with the medical duty to preserve life. That's why you signed the non-resident NRD, non-resident or something. So you tell the doctor they don't rescue you if you die. With the medical duty to preserve life, potential pressures on vulnerable group, the risk of a slippery slope to non-voluntary euthanasia, and argument that alternative treatment like hospice are sufficient. So, I guess that's it for now. Wow, my puppies are playing. Pros of euthanasia: bodily autonomy, death with dignity, relief of suffering. Hey guys, family and economic relief, organ donation, as well as the right to die is a personal choice. Even the government cannot interfere with this decision. The cons, to summarize: religious and moral opposition, slippery slope argument, which is a concern that legalizing euthanasia could lead to an erosion of safeguards, eventually resulting in a non-voluntary or involuntary killing. Lastly, vulnerability of patients and undermining medical duty, as well as available alternatives and the potential for abuse, which I don't think so, because if someone want to die, I believe that they should have the right to end their suffering, and that is what I'm going to do as well. So, all right. So the rest you guys can read. It's just legal differences with statutes in the United States, United Kingdom, and Canada. So that's all for now. Take care.